We have 1.7 million women living with HIV in Asia and Pacific. And this represents about 35% of all people living with HIV in this region.
My name is Pratima. I am a sex worker and I am living with HIV past 11 years. And my organization name called Ashodaya Samiti, which is a membership of more than 9,000. And we are working with, which comprises 3 community members, male sex worker, female sex workers and transgenders. And I am program director of this Ashodaya Samiti and I am leading this program.
สวัสดีค่ะชื่อสุขใจมุตตาพันธ์อายุ44ปีนะคะแล้วก็เป็นผู้ติดเชื้อHIV ทราบว่าติดเชื้อวันที่28กุมภาพันธ์ปี2536พอรู้ว่าติดเชื้อแล้วก็คิดว่าเราอยากจะทำงานเพื่อสังคมก็เลยเข้ามาทำงานเป็นอาสาสมัครของกลุ่มผู้ติดเชื้อก่อนแล้วก็ทำงานเป็นอาสาสมัครของเครือข่ายผู้หญิงที่อยู่ร่วมกับ HIV
We still have relatively high infection rates among key affected women and girls, which includes female sex workers, transgender women, female who use drug. But we also have an increasing epidemic among the female partners of men who are at higher risk.
Look, the epidemic is changing and we are seeing in some countries where epidemics are more mature, such as Cambodia and Myanmar, that increasing numbers of women are becoming infected through their male partner, usually a high-risk partner, perhaps as a client of sex workers or has sex with men. Often issues that the partner is unaware of and therefore she doesn't know she's at risk.
Well, I think that first of all, women need to have access to information and services, which is the most basic and the primary way of preventing HIV.
Because of lack of information, rural women who are illiterate and even they don't know what is that HIV, how it affects us, and that kind of women cannot timely enroll into the hospital.
I mean, I think it's absolutely crucial that we look at the fact that the provision of services alone is never going to be enough because there are fundamental barriers to women making informed decisions and reaching services. So we really have to be thinking about how do we address harmful gender norms? How do we put women in a place where they have the information and are enabled and empowered to make informed decisions in their own lives?
When I was diagnosed, I was immediately told to forget having children, and that was what they said in those days because it was just too much of a high risk. There was no medication, there was nothing, and also if the real aspect of not being around or alive when the child grew was real. So that I grieved more than actually getting HIV. That hurt me more than anything.
Who, when to have sex with, and how many children they want to make, when to access sexual reproductive health services, and being able to decide when to say no to sex, for example. These are basic autonomy and decision making that go a long way.
Women are women, whoever they are, and I think what's difficult is that very rarely in the HIV response are we focused on having conversations with women about their fertility intentions. And so we're not thinking about, are they wanting to have a child? How will we ensure that they have the right information to make informed decisions to have a safe pregnancy and a safe birth?
We also know that women living with HIV, when they are on treatment, can live a perfectly healthy life and have a full-term healthy pregnancy and give birth to a healthy baby.
ก็บอกว่าตอนนี้เรามีลูก2 คนถ้าคลอดคนนี้คือต้องทำหมัน
First of all, I'm Indigenous and come from a colonised reality. Second of all, I'm a woman, and there are still issues around gender equality, not only in my culture but in all the Pacific Island cultures. And thirdly, I live with HIV. So in my community, I'm seen as the AIDS girl.
We look into the sex worker and then they get the double stigma from their family environment because they are sex worker and also that they are the HIV positive.
If men diagnosed first with HIV, he can be treated by their family. But for women, it's very difficult to get treated.
I have had moments in my recent life where neighbours in my street have got together and held meetings and tried to get me and my husband out of our neighbourhood. So in saying that, you'd think in a progressive sort of developed country like New Zealand, things like that wouldn't happen, but they do.
ನಾವು ಮೂರು ಹಂತದಲ್ಲೂ ಕೂಡ ನಾವು ಹಿಂಸೆಗಳನ್ನ ನೋಡ್ಬೋದು. ಉದಾಹರಣೆ ಹೇಳಬೇಕು ಅಂತಂದರೆ ಪೊಲೀಸವರಿಂದ ಆಗಿರ್ಬೋದು. ಏನಂತಂದರೆ ಪೊಲೀಸವರಿಂದ ರೇಡ್ ಜಾಸ್ತಿ ಆದಾಗ ನಮ್ಮ ಸಮುದಾಯದವರು ತುಂಬ ನಾವು ಇಡನ್ ಆಗೋಗ್ತೀವಿ. ಯಾಕೆ ಅಂತಂದರೆ ನಾವು ಎಲ್ಲಿ ಹೋಗಿ ನಾವು ಸೆಕ್ಸ್ ಮಾಡ್ತೀವೋ ಏನು ಅನ್ನೋದು ನಮಗೆ ಅರ್ಥ ಆಗಲ್ಲ. ಆ ಸಂದರ್ಭದಲ್ಲಿ ಕಾಂಡಮ್ಸ್ನ ನಾವು ಯೂಸ್ ಮಾಡ್ತೀವೋ ಇಲ್ವೋ ಅನ್ನೋದು ಕೂಡ ನಮಗೆ ಒಂದು ಇದಾಗುತ್ತೆ. ಸೊ ಆ ಸಂದರ್ಭದಲ್ಲಿ ಏನಂತಂದರೆ HIV ರೇಟ್ ಜಾಸ್ತಿ ಆಗೋಂಥ ಸಾಧ್ಯತೆಗಳು ಜಾಸ್ತಿ ಇರುತ್ತೆ. ಅದೇ ರೀತಿ ಗೂಂಡಾಗಳು ಅಷ್ಟೇ. ನಾವು ನಿಂತಿರೋ ಜಾಗದಲ್ಲಿ ಅಂತಂದರೆ ನಾವು ಮಾಡೋಂಥ ಜಾಗದಲ್ಲಿ ಅವರು 10ರಿಂದ 15 ಜನ ಏನಾರು ಸೇರಿಕೊಂಡು ನಮ್ಮನ್ನ ಕರ್ಕೊಂಡೋಗಿ ರೇಪ್ ಮಾಡಿದಾಗ ಆ ಸಂದರ್ಭದಲ್ಲಿ ಕಾಂಡಮ್ಸ್ ಅವೈಲಬಿಲಿಟಿನೂ ಇರಲ್ಲ. ಆ ಸಂದರ್ಭದಲ್ಲೂ ಕೂಡ ಹಿಂಸೆಗಳು ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಮತ್ತು ಇದು HIV ಇನ್ಫೆಕ್ಷನ್ಸ್ಗಳು ಕೂಡ ಜಾಸ್ತಿ ಆಗುತ್ತೆ. ಅದೇ ರೀತಿ ಇದು ನಮ್ಮ ಬಾಯ್ ಫ್ರೆಂಡ್ಸ್ಗಳು ಅವರು ಏನಂತಂದರೆ ನಮ್ಮ ಕ್ಲಿನಿಕ್ಗೆ ಕಳಿಸಲ್ಲ. ಯಾಕೆ ಅಂತಂದರೆ ನಾವು 3 ತಿಂಗಳಿಗೊಂದ್ಸಲ ನಾವು ಚೆಕಪ್ ಮಾಡಿಸ್ಕೋಬೇಕು ಅಂತ ಅಲ್ಲಿಗೆ ಹೋಗಬೇಕು ಅಂತಂದರೆ ಸುಮ್ಮನೆ ಅಲ್ಲಿ ನಿನ್ನ ವೇಳೆನ ನೀನು ವೇಸ್ಟ್ ಮಾಡ್ಕೊತೀಯ ಮತ್ತು ಇನ್ನೊಂದು ಏನಂತಂದರೆ ನಿನ್ನ ಸಂಪಾದನೆಯೂ ಕಡಿಮೆ ಆಗುತ್ತೆ ಅನ್ನೋ ಒಂದು ಉದ್ದೇಶದಿಂದ ಅವ್ರು ಹೇಳ್ತಾರೆ. ಆ ಸಂದರ್ಭದಲ್ಲಿ ನನಗೇನಂತಂದರೆ ಗುಪ್ತರೋಗ ಜಾಸ್ತಿ ಆದಾಗ HIV ಇದು ರೇಟು ಜಾಸ್ತಿ ಈ ಎಲ್ಲ ಹಿಂಸೆಗಳು ನಾವು ತುಂಬಾ ಇದು ಮಾಡ್ತಾಯಿದ್ದೀವಿ.
Women, when they find out about their HIV status, tend to face higher level of violence. We have a global studies which says that once a woman declares her status to her family members, she is likely to face higher level of violence, or the constant threat of violence itself prevents women from accessing services when they need it.
So I found myself with someone who didn't mind that I had HIV, but he kind of used it in a way where he had power over me because I couldn't leave him. He could do whatever he wanted, and I felt like, well, if I leave him, no one else will want me.
If women have economic empowerment, I mean they're economically empowered, they have to have decision in her hand. As my experience, because before I had no anything with me and I was not treated early, but when I started to income and I went as I needed, and that's why the economic empowerment is most important.
So one of the key things that needs to be done in context of HIV response is that the interventions need to address these underlying barriers and inequality that are pervasive in our society.
We have mobilizing the women living with HIV in the ground level who are, actually delivering the messages to key populations or risk people, and so that they come to early test and treat.
The sex worker to sex worker, the community, they give the education or that they're sharing their experience is that come from the real. So they can share their experience and also they have the trust between them.
So we need to be really mindful of supporting governments to be bold, to do what's necessary to both meet the sexual and reproductive health rights of women and to ensure effective HIV responses in the region.
And when women comes to getting the services in a very critical condition and they go back, they praying us, you make my life change, you made me, you make me alive. And at that time I really feel, yes, she felt like me, and I feel really very proud of myself because, yes, I am doing well for others.